everybody. Good evening, and I'd like to welcome you to the Cambridge Research Systems talk tonight. Cambridge Research Systems has sponsored this talk. They are in one of the exhibitors in the poster session, so please do go and see their stand in the remaining days of ECVP. But I'm absolutely delighted to welcome today Professor Glyn Humphreys to give the talk. He's head of department at the University of Oxford. And Glyn actually started his research in visual perception, so very much the core of ECVP's interests. But since then, he's broadened his research into a range of very different areas, from cognitive neuropsychology, computational modelling, neuroscience, social cognition, action, and so on. And I think what he's brought to all of these areas has always been a combination of theoretical developments and insights, together with careful and creative experimentation using all of the techniques that we have today at our disposal. And because of this unusually broad range of research, I'm sure most of you in the room today will know of his work already from one or more areas, so I'm going to make no attempt to try to review it. But I do want to say that this kind of rare breadth of research interests means that Glyn's very well placed to work on integrating across different areas of perception, memory, and attention. And I think that the topic of his talk today on self-interest will really illustrate this. So without further ado, I'd like to introduce Glyn Humphreys.
So, can I be heard just with this microphone? Yeah. Okay, well, thanks very much to the organisers. Thanks, Rebecca, for really a very kind invitation. Thank you all, really, for sticking around after a hard day of psychophysics. I hope this will be, if not light relief, then at least some interesting relief for you. And the work I'm going to be talking about is very much a joint piece of work by myself and also by Shui Jie, who is a senior postdoc in our lab, who's really driving the more social cognitive neuroscience work that we're doing. And the work is really concerned with various kinds of biases that we can measure. And the particular biases that we've been interested in have been in relation to the self. Now, in psychology, the idea of trying to study the self clearly has a long history. For instance, if we go back to Sigmund Freud, Freud argued that having a self-representation actually plays some functional role in our cognition. In his case, a form of moderation between the kind of desires that may be driven by the id, a social context driven by the superego, in order to foster the best purposes of the individual. And other psychologists, such as William James, have tried to distinguish between different aspects of the self. So James distinguished between physical aspects of the self, for instance, in relation to our body, and body representations, mental, he even talked about spiritual aspects of the self. And one of the particular points he raised was that physical aspects of the self could be transferred to objects that are associated with us. And that's a particular point that will be highlighted, I think, by the work and the paradigms I'm going to talk about. Now, while there's been long-standing interest in the self and the self-representation, I think the majority of studies, it's been difficult to carry them out without relying on subjective opinion, the filling in of questionnaires, and other kinds of more qualitative analyses. But over the last 10 years or so within psychology, I think we've seen a different and, in some respects, a more indirect approach, which has been to study the way that self and self-reference, for instance, biases judgment, and we can then measure those biases objectively. And by trying to study the nature of the biases, what characterizes them, and so forth, we start to learn something, perhaps, about the self and the self-representation, and perhaps what it does in cognition. Now, there have been many attempts over these last 10 years using a variety of paradigms. Coming back here to Liverpool, I couldn't resist drawing on some, at least ex-Liverpool football, or Everton footballer. But one kind of paradigm has required judgments to faces. So if Wayne Rooney was ever going to be involved in a psychology experiment, which is pretty doubtful, but imagine he was. And the task is to decide whether this face is oriented towards him as the participant or oriented away. Then he would be faster at making the judgment to his own face there than to a face of another familiar footballer that Rooney knows pretty well, Steven Gerrard. And so even on some basic tasks such as that, there are self-biases, that is, better performance with self-reference stimuli compared to stimuli referenced to other people. But I think it remains unclear what kind of factors drive these effects. For instance, is it differential familiarity with the particular stimuli being used in these experiments? For instance, our own faces compared to other people's faces. I think it's also unclear, because many of the tasks are quite high level, what type of processes may be affected. For instance, is there any enhancement of perception? Are there changes in particular memory processes, and so forth? And because these tasks have been rather high level, it's often been difficult to work out the relations between some of these effects related to, for instance, the self and self-interest, and perhaps more basic factors that may, in fact, be driving performance. For instance, changes in reward value or changes in emotional value related to the stimuli. But in fact, major arguments about why self-biases occur are that the self is an inherently rewarding stimulus, and so we pay extra attention, for instance, to stimuli related to ourselves. So because of these kinds of issues remaining, I think, in the field, over the last few years, we've been trying to develop new and really very, very simple procedures to try and assess self-bias effects. And they're based around associative learning of self-reference in relation to simple stimuli. Due to the use of these very simple paradigms, we think we can use very common procedures for not only looking at self-interest and self-bias, but also biases in relation to some of these basic drivers, for instance, reward value or emotion value of the stimuli. And so we may look at them commonly. We can also take some of the stimuli that we've been using and then plug them into paradigms that more easily allow us to dissect the particular cognitive process involved. So I think it allows extensions into better controlled experimentation in some respects. So what I'm going to talk about are these experiments that we've been doing. And what I'm aiming to try and convey today is questions about what characterizes the self in these self-bias effects. What processes are affected when we show increased self-bias, and how do these effects relate to some of these basic drivers, such as reward-based effects and emotion-based effects. The talk will come in various parts. First of all, I'm going to introduce the self-association procedure, and just to demonstrate the basic self-bias effect that we've been manipulating. I want to try and put over that the effect's very robust, and it's also stable across individuals over time. I then want to put over the idea that self-reference, in some sense, in some kind of metaphoric sense, acts as a form of glue for integrating information, so you get better integration in perception and also in memory. And I'm going to argue that the effects, although in some respects seem to be related to effects of reward and emotion, actually can be distinguished from those effects, particularly, for instance, at a neural level. And the final take-home points that at this time I'll come back to are to argue that self-biases reflect the self as a kind of hub that is involved in filtering and integrating information, and that they reflect a specific attentional circuit in the brain. And I'll come back to reflect a little bit on the relations between these bias effects and attention. So, first of all, the basic self-association effect that we've been looking at. In these procedures, people are just given very simple stimuli, and they're asked to make an association, for instance, between the stimulus and a label. and the label can refer to a personal other person. So, for instance, they may be asked to form an association between this triangle and the label stranger, between this square and the label friend, and this circle and the label you. The particular labels that you use don't matter. So I know you has only got 3 letters, stranger's got more letters, it really doesn't matter. So you can use longer words, etc. The crucial thing is who you're making the association to. So people are given those stimuli, and then they're asked to carry out, for instance, a matching task. In the matching task, they're given the stimuli that they've made the association for, or they're given a repairing of the stimuli that we've been using. And they're just responding, yes, it matches, or no, this is a mismatch or a repaired trial. And that's all you may have to do. So if you would like to be subjects in this experiment, we want you to shout out yes if this is one of the originals I showed you, or no, it's a repairing. In the actual experiments, they're run in a variety of conditions, but quite often the stimulus is shown quite briefly, 100 milliseconds, and people are pushed to make a fast response within 1 second. So it'll rattle along. Ready? Okay, so that's all the stimuli are. They're really embarrassingly simple. I don't know if you could feel there's a difference in the responses, but the question is there a difference in those responses? People are given stimuli like this. These are data from a brute stat analysis coming from the basic experiment. But here you have accuracy of performance. Here you have reaction times. These are data for the responses to the self-matching stimuli. And these are data to, for instance, your best friend and a stranger matching stimulus. There's really a major advantage that people generate when they're responding to the self-match. This happens very quickly. You can just tell people to make an association between a stimulus and a label. You don't even really have to go through many practice trials at all, and you generate this result. One of the aspects of this particular result is that it shows some stability across individuals over time. So these are data from 2 tests of this particular effect. So here we have the self in white, in grey, responses to, for instance, a friend, and this might be a stranger baseline. These sessions are 1 month apart, the same individuals coming back into the lab. And here we can see that there's really quite good correlations between the individuals who show a very strong bias effect on time 1 and those who show it on time 2, or those who show relatively weak effects on time 1 and time 2. So there's some degree of kind of trait-like behavior in the stability of these effects. You bring people back again and they'll tend to show the same kind of bias, even in some simple tasks such as this. And one can go and look at how that relates to more questionnaire-based results in the literature, for instance. You can pull out some effects that may relate to how individualistic, for instance, an individual feels themselves to be. One other little aspect of the procedure and the kind of result you get is that there are at least some interactions with changes introduced by manipulating a perceptual variable. So for instance, if you run these experiments with a low contrast shape, and you're measuring, for instance, here D prime as a measure of sensitivity, then on the friend associations you can find quite reliable effects of reducing the contrast of the shape. But on the self-match trials, then there's much weaker effects of changing that perceptual variable. So these self-associations are less susceptible to reducing the perceptual quality of the stimulus. So there's some evidence here for a social association modulating some aspects of perceptual sensitivity, and maybe at least some aspects of a perceptual change taking place, although it may by no means be the only factor that's driving these effects. So that's some properties of the basic effect. It's really quite robust. it's very reliable over individuals over time, and, for instance, interacts with things like the contrast of the stimulus. If we now consider the nature of the self-bias effect, here I'm going to argue that there are some aspects in which making self-reference to a stimulus seems to enhance binding, for instance, of different visual elements. And we've looked at this in a variety of ways, but one way has been to look at redundancy gains that can occur. So in studies of redundancy gain, very often people might be asked to make simple choice responses between two different kinds of stimuli. So, for instance, they might be asked to discriminate a square from a circle. On some trials, they may get a single exemplar of the stimulus. In other trials, they may get two exemplars. So that would be a redundant trial, for instance, two circles being presented. And very often in the simple two-choice tasks, RTs to the redundant signal are faster than to the single-item trials. There's a redundancy gain. So redundancy gains occur when we have to verify the presence of a target, and performance enhance when there's two relative to a single item. Now, one of the aspects of redundancy gains that we were interested in is that you can carry out more formal modeling of the gains that you get. For instance, you can look at whether you get gains that are over and above the independent processing of the two exemplars that you may be presenting. And work in the literature suggests that those gains are particularly strong if, for instance, the elements cohere into a more global gestalt, if you like. So we were interested in applying this into the kinds of paradigms we've been using looking at social and self-association. So here we would be contrasting trials with a single item and trials with redundant stimuli. In the particular experiment, people were asked to associate two shapes with the self and two shapes with their best friend. So here you might have a circle and a square associated with the self. So you could then have either identical, perceptually identical redundant stimuli, or, if you like, two stimuli referring to the same referent, yourself, that is perhaps more conceptually related rather than being identical exemplars. The task that subjects have to do, having first carried out an association task, is simply to identify on the trial whether the shape or shapes refer to you or to your friend. So a simple two-choice RT task. And these are the data that we obtained. And what you can see here is this is performance on single-item trials. This is performance where you've got redundant items. This is the self, and this is for the friend discrimination. And what you see is a large enhancement, but particularly for the self-related stimuli. So the redundancy gains per se are larger for the self-stimuli than in this experiment for the friend. But in addition to this, as I mentioned before, you can carry out the more formal analyses to see whether you get violations of the independent processing of the elements in these redundant stimuli. There are various ways of doing this. This is a particular procedure, the rather obscure graphs, I'm afraid, up here, but I'll explain in a second. This is a procedure put forward by Jim Townsend and colleagues. And essentially, this is looking at the hazard rate for completing a response dynamically as you move a window over time for a given individual. And it's looking at the ratio of these responses in a redundant condition compared to single-item baseline conditions. So when this ratio is 1, then the redundant stimuli seem to be processed without any capacity limits. There's no loss in performance. It's equated to the single-item trials that you're looking at. When this capacity measure falls below 1, then there's evidence for interference of the processing. So processing is less efficient when you've got two items than when you've got single exemplars. And there can also be cases where this measure comes above 1, and then Townsend would argue that you have a super capacity situation. That is, people are responding to the two elements over and above the best efficiency that they have even with a single item. So you get violations of independent processing. So these are data shown here at the bottom for the conditions where you have self-associated stimuli. On the left-hand side, you had two identical shapes. On the right-hand side, you have two different shapes, but both associated with the same self-reference. At the top, you have the conditions where people are responding to the friend-associated stimuli. And there's an interesting contrast between these two cases. So here you have these measures over and above 1 for the self-related stimuli. You have some evidence for supercapacity in the processing of those two elements, which is more than these individual parts. With the friend-associated stimuli, what you have is a limited capacity processing. So there's interference with processing dropping below the no capacity limit 1 marker. So in some sense, the processing of the self has a kind of supercapacity that once you're making that association to yourself, the stimuli seem to be processed more easily as a single gestalt compared with when other associations are being made. And these effects, I think, can be found not only in perhaps more perceptual tasks like a simple shape discrimination and shape identification that we use there, but also run through into memory. And to look at memory, we've used adaptations of this basic procedure, no longer using very simple shapes, but actually pictures of objects, for instance. So in these tasks, subjects are asked to form an association between a personal label, like you, and a particular category of object, for instance, living things or animals. So every time you see an animal and the label you, that's a match trial, and you have to respond yes. There may be then other categories that would be associated with other personal labels. For instance, a tool might be the friend. And these associations are counterbalanced over subjects, so it's not an animal bias that we're seeing, and so forth. The reason we've moved here to different exemplars is that we're wanting to look at memory effects for the items afterwards. So can making this self-association alter how well you remember that a horse or a dog or a different animal was being presented compared with your memory for the other categories? One of the other things that you see in the displays here is that not only do we have a target here, the animal for you, but also we have a distractor item that's presented. For instance, furniture. And the reason we're interested here is what is the fate of a distractor item when you're making a self-association to another stimulus. So in the paradigm, people have to first of all match to the label. They're then given a surprise recall task at the end and said, well, tell me any of the items that you can remember. And we're interested, for instance, what happens to these items. So if you make an association to a target in you, can you better remember that target? But also, what happens to the items, these irrelevant items that are just present? And here we may think of one of two things. For instance, if you imagine that somehow you've allocated your attention here to making the match preferentially for you, then maybe this distractor gets very little attention and you have really poor memory for it. In contrast, if what happens is that when you make a self-association with the items in the display, somehow all of the items on the episode get linked or bound together, then in fact you may actually have better or enhanced memory for the distractor on this trial compared to the distractor on this trial, even though subjects are typically responding faster here than here. So are there effects of these associations running through to memory? Does it affect distractors as well as targets? So these are the kind of data that you get. These are on the encoding trials, that is making the matches. And what you see here is that there's a standard advantage taking place, for instance, for the self over the friend, both in RTs and in accuracy. So people are faster at making those initial matches to self-associations. If we then look at the memory for these items, then for instance in recalling the relevant items, for instance the different animal exemplars, there's some advantage for the self items over those associated to the friend. But interestingly, that also can come through to the distractors. So there's poor memory performance for those distractors, which after all are completely irrelevant during the encoding phase, but performance on the self-associated items tends to be better than performance on the friend-associated items. And that particularly comes through if you look at pairings of target and distractors that are remembered together. So that when people remember the target, they're very often also able to pull out the distractor on the U-associated trials. So there's a self-advantage here for this association in memory for irrelevant as well as relevant items. And one way to think about this is somehow this self-association is acting to enhance the binding that's present on the trial for those items between the label and also between the objects. So self-bias is linked to greater integration in perception and in memory, and that in some sense this self-reference seems to provide a form of perceptual and memorial glue. The third point that we were interested in is by using this very simple paradigm, what's the relationship between these sort of strange self-associations people are making and more basic things perhaps relating to reward or emotional value of stimuli. So you can carry out very similar procedures, not just with self-associations, but with other associations. So in the self-association task, you might be asked to form a link between you and circle, friend and square. You can run reward association tasks in which you have to make a link between different reward values and a circle. So for instance, £8 is associated with the circle, 50p associated with the square. In the reward experiments, participants are also given actual rewards differentially for making correct responses, for instance, on the match trials. So if you correctly match circle and £8, you get 16 times the reward compared with making a correct match for 50p and a square. Or you can run emotion associations, for instance, having a happy face associated with a circle or a neutral face with a square. If you run those different association tasks, you get qualitatively quite similar results that come through. So here we have a self-bias effect in which RTs for self-matches are faster than other matches. Here we have an emotion bias effect in which RTs for the happy shape association are faster than for the neutral shape association. And here is a reward bias in which RTs for the high reward association are faster than those for the low reward association. So you can establish reliable effects with these other variables, and just like the self effects, these factors are also stable across individuals over time. So individuals who show a strong sensitivity to the reward value do so on different occasions. Also, if you do things like manipulate the contrast, for instance with reward, you again get interactions with the contrast of the stimulus. High reward stimuli show less effect of contrast reduction than low reward stimuli. But does all of those similarities indicate that the basic factors really are the same? Is the drive towards responding fast to self-related stimuli really because they have a high reward value for us or not? Or is it because they have a very positive emotional value for us, and so we are faster in identifying and responding to them? So we tried to look at these relationships in various ways. And one way is by using fMRI to try and identify which neural mechanisms may be involved in supporting these bias effects. Essentially, if the bias effects are reflecting the same kind of currency, if you like, then the neural structures that are supporting self-bias should also support reward bias, for instance. And if you can identify the neurons that are discriminating reward, they should also be able to discriminate self from others. So we've looked at that in several ways. So these are images of a set of brain areas that have been picked out because in the literature, these are areas that very often respond to either reward or differential reward values or to the effects of self-reference, for instance, in memory tasks. So here we have a set of regions which fall in the ventromedial prefrontal cortex, or VMPFC, and the more anterior region here is an area that, across a number of studies, has shown sensitivity to different reward values. So neurons within this anterior region are showing a greater response for higher reward. In this more posterior region, coming back here, is an area where stronger activity has been shown after self-reference compared to reference to other people in memory tasks. And then what we've done is plot a series of ROIs going from the more anterior to the more posterior ROI in order to look at sensitivity to reward and self along this, if you like, anterior-posterior axis along the VMPFC. And what we've been interested in doing is using things like pattern classification to see whether you have common or distinct neuronal populations that may be classifying the stimuli according to the discriminations we're asking people to make. So in one case then, we've looked at whether you can train classifiers to discriminate self from other people or high reward from low reward when people have carried out these tasks within the scanner. So here we're looking at training on self and then testing on an independent set of data for self versus other. Training on high versus low reward, testing on an independent set of data for high versus low reward discriminations. So can these different areas discriminate the self from others? Can they discriminate high versus low reward? These are the different ROIs. This is classification performance. And in all of the cases, classification falls above chance for both the self, so discriminating self versus other, and for discriminating high versus low reward. Although you can see here towards the more posterior ROIs, so going further back along the VMPFC, that the self-classification is particularly strong. So that just indicates that within each of those areas, there are neurons that are able to discriminate between the stimuli that we are asking subjects to discriminate. The more interesting case is what happens if you train the classifier on, for instance, the self versus other distinction, and then give it high versus low reward stimuli to test, to pull apart, or vice versa. And these are the classifications that you then see going along this axis from the more anterior areas to the more posterior region. So within the anterior regions, you get some degree of generalization, that training on the self allows those neurons also to be discriminating between high and low reward. But in the more posterior areas, you don't get good generalization, and performance isn't different from chance. So here, there are sets of neurons that can discriminate between the self and others, but do not discriminate between high and low reward stimuli, or vice versa. So what it looks like is there's some kind of shift from overlapping to more differentiated, distributed representations within these different areas as one moves along this anterior-posterior axis along the VMPFC. So some suggestion that reward could be pulled apart from the self-bias effects. A second way to look at that is through neuropsychology. So rather than looking at classifiers, looking at the effects of brain lesions on different areas that we may think are involved in these kinds of discriminations. And these are data just from 2 patients. It comes from a larger stroke population, but lesions that are going to involve the VMPFC in the stroke population are not particularly common. But these are 2 patients who have lesions of the VMPFC, plus also of the insula, shown back here. And these are the bias effects that are shown by the patients and also by age-matched control subjects. So here, if there's a positive bias, that means that subjects are, for instance, faster at responding to self-stimuli than other stimuli. So that's the self condition here. And what you can see is that controls show a positive bias. They're faster for the self than others. These two patients, however, unusually show no self-bias in that particular task. So they show a kind of hypo self-response. In contrast to that, if you look at some of the other associations, for instance, this is the association to emotion stimuli, then these two patients show an enlarged bias compared with the control population, which is shown here. So after these lesions, you can have dissociations take place in which some patients don't show such a strong self-bias, but these other effects or these other factors can actually be increased in some cases, suggesting at least some evidence for dissociations between the different drivers of the bias. So the neuropsychological and the fMRI data, I think, converge that these are not necessarily the same phenomena, though they're all interesting phenomena that we can measure. And I'll just mention one other kind of reason for making this argument, which comes from experiments where we've tried to pit one factor against the other. For instance, by having people make a low reward association to themselves and a high reward association to another person. Can you trade off these different forms of bias? So in this study, we got people to make associations between different labels. You, £0. Your friend, £5. Stranger, £15. And if they match the stranger and £15 correctly, they get, for instance, 3 times the reward value than they get for their friend. And they don't get any reward value for making the match to themselves. So what happens in these circumstances? Does reward swing the self-advantage or not? These are data, for instance, if you look at the D' data from this particular study, this is the pattern of results we found. And there's a couple of interesting aspects of these results if you're looking at them. So one is this effect here. Here we have D' for the self, here we have D' for the stranger, and what you can see is that the self wins out. So that even though you've got a larger reward for another item, people still continue to show self-biases. Perhaps I should just put a caveat there. Oxford University students continue to show self-biases. On the other hand, you get this result here, which is a comparison between the friend and the stranger. And the result here is that, perhaps unfortunately, one can trade off the usual benefit you get for your friend relative to having a higher reward value for another stimulus. So there are interesting things that one can do pairing together these different forms of association. But having high reward values, at least within the range that we've tried to look at, is not sufficient to override the very strong bias that people have towards their self-associated item. So the self-bias effects are not simply linked in some kind of linear way, anyway, to the reward values that we've been playing around with. So I presented various pieces of evidence. One is that self-bias effects can be elicited in very simple association learning tasks. And they act like an individual trait, so that people are quite consistent in the magnitude of the effects and the differential magnitude that they show. Secondly, there's some evidence that making a self-reference can reflect a kind of super-integration of stimuli. For instance, in simple shape discrimination tasks where you get violations of independence by referring the stimuli to yourself, and in memory tasks where you get enhanced memory for items that are occurring on a self-association trial. And finally, self-bias is not just driven by reward or by emotional valence. And one can see, for instance, dissociations in patients on these factors. So what I want to conclude with is just perhaps a couple of slightly more theoretical points that one can derive from the data that I've presented. And these are going to concern ideas about binding and ideas about the relations between self and self-reference and attention. And when thinking about binding, we are perhaps postulating that activating some form of self-representation, for instance, within the VMPFC, which we think is a good candidate for such a hub in information processing, may act to enhance binding of items coming through into perception, items as they're formed in memory and in decision-making, and so forth. And it's interesting to speculate on what may be some of the underlying mechanisms for that. For instance, are there changes in various neurotransmitters that are made by making self-associations to stimuli that lead to these changes in binding that so far we've measured behaviorally? The second aspect relates to the relationship between these self-biases and attention, because we would argue that quite a few of them can be explained by saying that attention has been enhanced to the stimulus that you're making a self-reference to. But the question is, how does that come about, and what are the particular attentional mechanisms involved? So I refer back here to one fMRI study that we've conducted looking at self-bias effects. So here subjects were just carrying out matches to the self, to friends, to strangers in the scanner. And this is the contrast between the self stimuli and the stranger stimuli, so more activation for the self. We picked out here two particular regions that show this increased activation. One is within the VMPFC, and the other is in a more posterior area, in the posterior superior temporal sulcus. The VMPFC, as I've mentioned already, is an area classically associated with self-reference in a whole variety of tasks, from memory, from trait evaluation, and perceptual matching. One can argue that this posterior STS area is part of a more ventral attentional network that is modulating attentional responses to a salient stimulus in the environment. And in modeling the fMRI work, it turns out that the functional connectivity between VMPFC and the STS area here is increased for self-association trials compared with other associations. So we think that maybe some linkages of these self-associations to attentional areas in more posterior regions may be a substrate for the effects. If you look at the opposite contrast, then you get different brain regions, for instance here in more dorsal frontal regions and posterior parietal regions, that are more active not for the self, but for instance, the harder association, the stranger association. And these are regions, I think, more classically linked to parts of a dorsal attentional control network. And consistent with this being a more difficult association for people to form and then to respond to. So one way of trying to think about that is to suggest that we may have, for instance, this top-down attentional control network, classically involved with posterior parietal and prefrontal regions, but also these regions that respond in a more data-driven way to associations between self-stimuli and stimuli that you've associated with the self in the environment. And normally these networks may either cooperate or not cooperate, may cooperate in cases where it's beneficial for the task, or in some cases they may inhibit one another so that, for instance, if the self is a distractor, then you may need to recruit attentional control regions. And one little piece of evidence that's consistent with this kind of attention network idea is what happens to patients after they have lesions of, for instance, dorsolateral prefrontal cortex. So here's data from a couple of patients in self-associations, reward associations, and emotion associations compared with control levels of bias. And what you can see is that these patients with more executive lesions, if you like, very typically show enhanced or hyper biases across the board, really, to the self, to reward, and to emotion, consistent with damage to a kind of attention and control network here, so that they're responding more automatically to the activity that's driven through this network. So in conclusion, what I've tried to present is evidence suggesting that this very simple self-association and self-representation can act as a kind of cognitive enhancer in memory and perception. And these self-bias effects may reflect a very basic aspect of human cognition, which is to produce enhanced attention to self-related stimuli. For instance, if you're with a group of people, for instance, and then it's your own child that's moving, you have enhanced attention to that very salient stimuli. And we're also interested in trying to harness some of these self-bias effects to actually improve memory and attention, particularly in certain neurological populations. But that would be another talk. So it remains just to say thank you to the people who's funded this work, and thanks for staying and listening. Yeah, sure.
So thanks so much to Glyn for that talk. Glyn's willing to take any questions if people want to ask, so I'll just...
Sorry, so, yeah.
Sure. So in your last example with a child, when you're being particularly attentive to self-relevant stimuli, you indicated a possibility that it's really not the self, but a stimulus that you really, really care about. So let's say you're a soldier and has to guard a particular person, then this person becomes super salient. So have you ever tried to contrast stimuli that would be not self, that would be just extremely relevant to you?
Yeah, so I think there are dimensions of relevance that come through, and we just happen to tap into it with these very simple bias measures. But these effects of relevance occur, for instance, in teams. So if you take Oxford rowers, for instance, even for their colleges, then they show enhanced attention to stimuli associated with the college compared with other stimuli. And you show similar violations of redundancy gain for those items too. So while the self, I think, is a particularly strong stimulus in these associations, I don't think it's so special in some respects. It's picking up on a way that we seem to prioritize various kinds of information. Yeah. Yeah.
What about people who have low self-esteem, like depressive?
Yeah. At the moment, I don't know. We've got one of the members of the lab who's out there trying to test people with low mood, for instance, and whether you get... I think the results... And we've done one intervention study where we tried to change mood by a mood inducer, which inducing low mood tended to reduce the bias effects coming through. But it would be extremely interesting if these are simple behavioral measures rather than typical questionnaires that you could link into various neuropsychiatric populations too. Yeah.
It's very interesting finding. I'm just wondering where you're making associations that say the circle and the word you. And it's only a word you, Y-O-U. Do you think they really think that Y-O-U is themselves?
Yes. So I don't know exactly. So part of the idea of this is clearly the self. There's a long history within psychology, and it's a very complex concept, and many aspects to it. So the idea is, can we try and develop objective paradigms that will allow us to start and decompose which aspects of the self are important or not? So one aspect that I think we do have some evidence on is that when people are making the self-association, they're sensitive to the reference frame in which you're presenting stimuli. So if you present stimuli within your own reference frame, you increase the self-bias effect. And through that, we would like to start looking at whether aspects of body representation and so forth can be sensitive to it. So do they really think of that themselves? Well, themselves is a complex concept. I think there are aspects of that complex concept in which we are tapping into.
Glyn, there's only one self, there are many friends, many strangers.
Yes.
Would that explain it?
Is that a personal comment or? So does the uniqueness, I don't think the uniqueness per se, so if you make people make associations to their best friend or their mother, for instance, you only have one mother, and you still get a self-bias over and above that kind of very personal association. So I don't think it's just the uniqueness, although that could well be one factor. Yeah.
So you said that the self-bias effect is long-lasting, so you can see it after a month.
Yeah.
But how do you know it's the same effect instead that people are just relearning it or learning it again?
Oh, sorry. What I was meaning was not that the association they've made per se, but the people, the individual differences are stable. So the people who show a strong association, you come back, you get a new association to themselves, they still show a big bias to themselves. So it's not the learning of the association that's maintaining, it's an individual difference trait-like behavior. I don't know how long before you want to go on. Maybe
One question. The effect size of
Yeah.
this self-effect, is it correlated with any personality trait variable?
So at the moment, I can say that it tends to correlate with how individualistic people rate themselves as being. And that's of some interest, for instance, for people interested in cultural psychology or cross-cultural psychology, where there may be differences across culture in individualism versus more collective cultures. And the effect size varies with those kind of factors. So I think there are some things like that. Also, if you get people to self-rate how distant they feel themselves from other people, that also correlates with this result. So I think there are some factors underlying there too. Maybe, I don't know, this on the left-hand side?
So looking at your fMRI data, is there any relationship between the areas you're activating and the default mode network? And secondly,
Yeah.
I noticed that the activation was on the left. Does everyone have their self on the left?
Well, so if I take that first one first, I would be cautious about making that kind of inference. Partly because all of the experiments really I presented you with have been making associations to a verbal label. And so to what extent that verbal mediation of the task comes into it, I don't know. So I think, we need more data, different kinds of associations and so forth. In terms of the default network, then parts of the VMPFC are involved typically in a default network activity. And so you do see some commonality. Now, you can then get into arguments about what are you measuring under default resting state conditions, for instance. Are people thinking about themselves or not, and so forth, yeah. And
Grilled for Glyn enough now. So if we could just thank him once again for a fantastic